This is going to be a quick reset practice for your feet. And I'll just preface it by saying that if you have a lot of pain in your feet, you have a diagnosis pertaining to your feet, or you think you might need a diagnosis pertaining to your feet, you might want to hold off on this practice and make sure by checking in with your medical team if it is a practice that is appropriate for you and for what's going on in your feet. This practice will also require that you be able to touch your feet with your hands. And so if that is not something that you want to do for any reason or not something that you can do, then you just need a different practice. This won't be the best practice for you. But if you just have achy or tired feet and you want to give your feet a little bit of love, this might be a really good practice for you to try. I am currently seated on the floor in a cushion, but you could also do this practice seated in a chair. We're going to start by bringing the opposite hand to the opposite foot. I'm going to mirror you so it makes sense on your screen. So we'll call this your right foot and your left hand. To do this, I like to straighten my opposite leg out and cross my ankle over my thigh. You could do this seated in a chair as well. And the aim here is going to be to interlace the webbing of your fingers with the webbing of your toes. Now, if you're wearing jewelry you can't remove, or if you have, for example, broken a toe in the past, you may find that it just isn't comfortable or appropriate for you to interlace all of your fingers and toes. You can just do your best. This can have some sensation associated with it, especially if your toes are used to being squeezed in towards each other, but we don't want it to be painful. So if you're finding this is extremely uncomfortable, again, you may want to discontinue and get some personalized assistance. If you've got your fingers and toes interlaced, you can give the ball of your foot a squeeze. And then I'm going to introduce some movements here. So you can do all of them. You can choose to do just some of them. We're going to start by adding a twist through your forefoot. So you're going to maintain that little bit of squeeze through the ball of your foot. And you're going to think about taking the top of your big toe forward and down towards the floor, and the top of your pinky toe forward and up. And just adding some twist through your forefoot. Keeping this comfortable and easy. There definitely can be some sensation as we mobilize the foot. You get to choose what's comfortable for you. After you've done a few of these, we're going to add in the second movement through the ball of your foot. For this one, you're going to think about all of your toes moving together. We're going to take the toes forward and then take the toes back. As much as you can, you're going to move through the whole ball of your foot in both directions. It can be hard to get that pinky toe side of your foot moving. Don't need to be perfect. Just include it in your awareness of the movement. We're looking for this to be comfortable as well. Sometimes there's some intensity. There should not be pain. And then we'll add some ankle circles. So when I do this, it's helpful to bring the opposite hand to the shin to help keep the leg stiller. I'm going to use your hand to guide circles in your ankle in your largest comfortable range of motion. You may find it's helpful to add that little bit of twist to the forefoot as you go as well. And we're going to go both directions here. Getting that movement through your ankle, your foot, maintaining that little bit of squeeze in the ball of the foot. Come into stillness, give the ball of your foot one more squeeze. Release. Disentangle the hand from the foot. Sometimes it's fun to do a little bit of a visual check and just compare side to side. Notice what changed in your foot that you worked on. And then we'll take the other side. Again, doing your best to interlace fingers with toes and down into the webbing. And then giving the ball of your foot a squeeze. It is normal to be different side to side. You're going to give this foot as much love in its own right as you give the other foot. We do not need to do things that hurt this foot just because we did them on the other foot. So doing your best to find a place that's comfortable, adding that little squeeze to the ball of the foot, and then we'll add the twist through the forefoot, taking the top of the big foot toe forward and down, top of the pinky toe forward and up. Moving through your forefoot. Maybe lingering with each movement a few times, just noticing how it feels on this side. And then we'll take that second movement through the ball of your foot, taking all of your toes forward, all of your toes back. Seeing if you can get the pinky toe side of the foot moving, as well as the big toe side. After you've done a few of these, light squeeze to the ball of your foot, opposite hand to the shin to minimize movement of the leg. You're going to use your hand to create circles through your ankle. Sometimes we just can't reach through the arm for the whole range. Just do the best that you can. Giving some attention to our feet is often helpful because they don't get a lot of attention. Go the other way. And our feet are, when we're standing and walking, how we relate to the ground. They got a lot of forces moving through them. It's really helpful to have healthy feet. If you didn't circle both ways, make sure you circle both ways. Maybe allowing some movement to come into your forefoot as well as your ankle. And when you feel complete, you'll give a squeeze to the ball of your foot. Disentangle the fingers. Compare the sides. And then if you like, we'll give a little bit of a massage to the top of your foot. So to do this, you're going to bend your knee, bring the sole of the foot to the floor. And we'll use the opposite hand here to widen the big toe out a bit. So you have some space between your big toe and your second toe. And then you're going to use one finger to massage in between the toes. The top of the foot can be really bony. We don't need to be pushing on bone. That's not particularly helpful. If you can get into the soft spaces in between the toes, that's where we want to give a little massage. We're going to just repeat this with every toe. So creating a little space between the toes and then massaging the top of the foot into the softer space. And you'll notice that some of the toes have more bony quality in that area. And you may not be able to massage as much or as far. Doing your best to find a comfortable stimulus. You can give into this tissue in the top of the foot. Doing all of the toes, creating space first. And massaging a little bit through the top of the foot area. Notice how your foot looks and feels, and then do the other side. So remembering we're using one hand to create that space in between the toes, the other hand to massage. Often people like to massage with the dominant hand. That hand gets tired. You can always try giving your other hand a chance to do the work here. And just creating space, finding those softer areas in between the toes. You may never have given attention to the top of your foot before. This is not a common area we spend time. And remembering to go all the way into that pinky toe side. Taking a little time with each set of toes. And then whenever you feel ready, checking in with both feet, see how they feel. I would recommend standing on your feet and walking around on your feet, noticing how your feet and your whole body feel after this. I hope they feel great. I would love to hear how this went. And if you found this helpful, use as a practice you may like to do regularly.